Rasta, visiting a Jakarta AIDS clinic for the first time, is apprehensive.
I am afraid of what I might find out from the HIV test.
Lisa Baldwin is the U.S. Agency for International Development's HIV/AIDS advisor in Jakarta. She says while Indonesia has only a 0.1% HIV infection rate, cases are increasing, particularly within high-risk groups, sex workers, homosexual men, and injecting drug users. Treating these groups now, she says, could prevent a wider epidemic.
They're a population that could really be a bridging population to the more general community. So I think there's opportunity to really, clamp down and keep this, more contained. But there are also opportunities for it to spill out.
But some members of the Islamic community object to programs they say condone immoral behaviors. Nasia Maboy, the Secretary General of the Indonesian National AIDS Prevention Commission, says its role is not to judge the patient, but to treat and prevent the disease.
While those that think this is the disease of sinners, I usually say, well, they're still Indonesians. Sinners or not sinners.
In China, the UN says 700,000 people live with HIV or AIDS. In the past, health officials say misinformation about how the disease spreads, discrimination, and a lack of treatment made people reluctant to seek help. But a public education campaign and efforts by international organizations like the Global Fund to provide free AIDS treatment helped change that. Still, Jiang, who lives with AIDS in Beijing and does not want his identity known, says the stigma remains.
I only tell other patients and nurses about my condition. The pressure in society is too much.
Thailand reduced the spread of HIV by educating sex workers. Former cabinet minister and activist Michai Virawaidia led efforts to promote condom use. He even opened a restaurant called Cabbages and Condoms, which gives condoms to diners. Michai says government commitment was key to Thailand's success.
Firstly, there was political commitment and financial commitment. For all the money spent on HIV prevention or treatment in Thailand, 90% came from the government or came from within the country, only 10% from the outside. So many countries don't have the political nor the financial commitment and expect the rest of the world to save you.
USAID's Baldwin says international donors expect economically strong Asian countries to take over more funding for AIDS programs.
I think the donors are all prioritizing on, and one of the factors that's always considered is how much money is there, within the local economy should there be to contribute.
In some countries, such as Indonesia, donors provide 80% or more of the AIDS funding. Baldwin says that cannot continue indefinitely. Brian Padden, VOA News, Jakarta.